1. What does the root word hepat- refer to in medical terminology? Answer: liver rationale. The root word hepat- pertains to the liver, derived from the Greek hepar. It is used in terms like hepatitis, liver inflammation, and hepatectomy, liver removal. Understanding this root aids nurses in interpreting liver-related diagnoses and procedures. 2. What is the meaning of the root word cardio- in a patient's diagnosis of cardiomyopathy? Answer: heart rationale. Cardio- refers to the heart, from the Greek cardia. In cardiomyopathy, it indicates heart muscle disease. Nurses use this root to understand cardiac conditions like cardiology, heart study, or electrocardiogram, heart electrical activity. 3. What does the root word nephro- indicate in the term nephrology? Answer: kidney rationale. Nephro- means kidney, from the Greek nephros. In nephrology, it denotes kidney study. This root appears in terms like nephritis, kidney inflammation, and nephrectomy, kidney removal, guiding nurses in renal care. 4. What is the root word dermato- referring to in a patient with dermatitis? Answer: skin rationale. Dermato- refers to the skin, from the Greek derma. In dermatitis, it indicates skin inflammation. Nurses encounter this root in terms like dermatology, skin study, and dermatoma, skin tumor, aiding in skin-related assessments. 5. What does the root word gastro- mean in the term gastroenteritis? Answer: stomach rationale. Gastro- pertains to the stomach, from the Greek gaster. In gastroenteritis, it indicates stomach and intestinal inflammation. This root is seen in gastrectomy, stomach removal, and gastritis, stomach inflammation, critical for GI nursing care. 6. What is the meaning of the root word neuro- in a patient's neurology consultation order? Answer: nerve rationale. Neuro- refers to nerves or the nervous system, from the Greek neuron. In neurology, it denotes nerve study. Nurses use this root in terms like neuropathy, nerve disease, and neurosurgery, nerve surgery for neurological care. 7. What does the root word osteo- indicate in the term osteoporosis? Answer: bone rationale. Osteo- means bone, from the Greek osteon. In osteoporosis, it indicates bone porosity. This root appears in osteomyelitis, bone infection, and osteotomy, bone cutting, helping nurses understand skeletal conditions. 8. What is the root word pulmo- referring to in a diagnosis of pulmonary edema? Answer: lung rationale. Pulmo- pertains to the lungs, from the Latin pulmo. In pulmonary edema, it indicates lung fluid accumulation. Nurses see this root in pulmonology, lung study, and pneumonia, lung inflammation, guiding respiratory care. 9. What does the root word onco- mean in the term oncology? Answer: tumor rationale. Onco- refers to tumors or cancer, from the Greek onkos, mass. In oncology, it denotes cancer study. This root is used in oncogene, cancer-causing gene, and oncologist, cancer specialist, critical for cancer nursing. 10. What is the meaning of the root word thoraco- in a procedure called thoracentesis? Answer: chest rationale. Thoraco- means chest, from the Greek thorax. In thoracentesis, it indicates chest fluid removal. Nurses encounter this root in thoracotomy, chest incision, and thoracoscopy, chest examination, aiding in chest-related procedures. 11. What does the root word myo- refer to in the term myocardial infarction? Answer: muscle rationale. Myo- pertains to muscle, from the Greek mys. In myocardial infarction, it refers to heart muscle death. This root appears in myopathy, muscle disease, and myalgia, muscle pain, guiding nurses in muscle-related conditions. 12. What is the root word angio- indicating in the term angiography? Answer: vessel rationale. Angio- means blood vessel, from the Greek angion. In angiography, it denotes vessel imaging. Nurses use this root in angioplasty, vessel repair, and angioma, vessel tumor, critical for vascular care. 13. What does the root word cranio- mean in a patient with a craniotomy? Answer: skull rationale. Cranio- refers to the skull, from the Latin cranium. In craniotomy, it indicates skull incision. This root is seen in cranioplasty, skull repair, and craniosynostosis, skull suture fusion, aiding neurosurgical nursing. 14. What is the meaning of the root word arthro- in the term arthroscopy? Answer: joint rationale. Arthro- pertains to joints, from the Greek arthron. In arthroscopy, it denotes joint examination. Nurses encounter this root in arthritis, joint inflammation, and arthroplasty, joint replacement, guiding orthopedic care. 15. What does the root word hemato- indicate in the term hematology? Answer: blood rationale. Hemato- means blood, from the Greek haima. In hematology, it indicates blood study. This root appears in hematoma, blood collection, and hemoglobin, blood protein, critical for hematologic nursing. 16. What is the root word psych- referring to in a patient's psychiatric evaluation? Answer: mind rationale. Psych- pertains to the mind, from the Greek psyche. In psychiatric, it denotes mental health care. Nurses use this root in psychosis, mental disorder, and psychotherapy, mental treatment, guiding mental health nursing. 17. What does the root word chem- mean in the term chemotherapy? Answer: chemical rationale. Chem- refers to chemicals, from the Greek chemia. In chemotherapy, it indicates chemical treatment for cancer. This root is seen in chemoprophylaxis, chemical prevention, aiding nurses in pharmacology. 18. What is the meaning of the root word tox- in a patient with toxicology screening? Answer: poison rationale. Tox- means poison, from the Greek toxicon. In toxicology, it denotes poison study. Nurses encounter this root in toxemia, blood poisoning, and detoxification, poison removal, critical for emergency care. 19. What does the root word endo- indicate in the term endocrinology? Answer: within rationale. Endo- means within, from the Greek endon. In endocrinology, it refers to internal gland study. This root appears in endoscopy, internal examination, and endocrine, internal secretion, guiding endocrine nursing. 20. What is the root word broncho- referring to in a diagnosis of bronchitis? Answer: bronchus rationale. Broncho- pertains to the bronchus, from the Greek bronchos. In bronchitis, it indicates bronchial inflammation. Nurses use this root in bronchoscopy, bronchus examination, and bronchodilator, bronchus opener, aiding respiratory care. 21. What does the root word Colorado- mean in the term colonoscopy? Answer: colon rationale. Colorado- refers to the colon, from the Greek colon. In colonoscopy, it denotes colon examination. This root is seen in colitis, colon inflammation, and colostomy, colon opening, critical for GI nursing. 22. What is the meaning of the root word rhino- in a patient with rhinitis? Answer: nose rationale. Rhino- pertains to the nose, from the Greek rhes. In rhinitis, it indicates nasal inflammation. Nurses encounter this root in rhinoplasty, nose surgery, and rhinorrhea, nasal discharge, guiding ENT care. 23. What does the root word ophthalmo- indicate in the term ophthalmology? Answer: eye rationale. Ophthalmo- means eye, from the Greek ophthalmos. In ophthalmology, it denotes eye study. This root appears in ophthalmoscope, eye instrument, and ophthalmitis, eye inflammation, aiding eye care nursing. 24. What is the root word ot- referring to in a diagnosis of otitis media? Answer: ear rationale. Ot- pertains to the ear, from the Greek os. In otitis media, it indicates middle ear inflammation. Nurses use this root in otoscopy, ear examination, and otorrhea, ear discharge, critical for ENT nursing. 25. What does the root word vaso- mean in the term vasoconstriction? Answer: vessel rationale. Vaso- refers to blood vessels, from the Latin vas. In vasoconstriction, it indicates vessel narrowing. This root is seen in vasodilation, vessel widening, and vasospasm, vessel spasm, guiding vascular nursing. 26. What is the meaning of the root word phlebo- in a procedure called phlebotomy? Answer: vein rationale. Phlebo- means vein, from the Greek phleps. In phlebotomy, it denotes vein incision for blood draw. Nurses encounter this root in phlebitis, vein inflammation, aiding in IV therapy and blood collection. 27. What does the root word spleno- indicate in the term splenomegaly? Answer: spleen rationale. Spleno- refers to the spleen, from the Greek splen. In splenomegaly, it indicates spleen enlargement. This root appears in splenectomy, spleen removal, critical for abdominal nursing assessments. 28. What is the root word chole- referring to in a patient with cholecystitis? Answer: gallbladder rationale. Chole- pertains to the gallbladder, from the Greek chole. In cholecystitis, it indicates gallbladder inflammation. Nurses use this root in cholecystectomy, gallbladder removal, guiding biliary care. 29. What does the root word pneumo- mean in the term pneumothorax? Answer: lung rationale. Pneumo- refers to the lung or air, from the Greek pneumon. In pneumothorax, it indicates air in the pleural space. This root is seen in pneumonia, lung inflammation, aiding respiratory nursing. 30. What is the meaning of the root word uro- in a patient's urology consultation? Answer: urine rationale. Uro- pertains to urine or the urinary system, from the Greek auron. In urology, it denotes urinary system study. Nurses use this root in urography, urinary imaging, and urolithiasis, urinary stones, guiding renal care. 31. What does the root word adeno- indicate in the term adenocarcinoma? Answer: gland rationale. Adeno- means gland, from the Greek aden. In adenocarcinoma, it indicates glandular cancer. This root appears in adenopathy, gland disease, and adenoma, gland tumor, critical for oncology nursing. 32. What is the root word lipo- referring to in a diagnosis of lipoma? Answer: fat rationale. Lipo- pertains to fat, from the Greek lipos. In lipoma, it indicates a fatty tumor. Nurses encounter this root in lipolysis, fat breakdown, and lipid, fat molecule, aiding in metabolic care. 33. What does the root word cyto- mean in the term cytology? Answer: cell rationale. Cyto- refers to cells, from the Greek kaitos. In cytology, it denotes cell study. This root is seen in cytopenia, cell deficiency, and cytotoxic, cell killing, guiding nurses in lab and oncology care. 34. What is the meaning of the root word histo- in a patient's histopathology report? Answer: tissue rationale. Histo- means tissue, from the Greek histos. In histopathology, it indicates tissue disease study. Nurses use this root in histology, tissue study, aiding in biopsy interpretation. 35. What does the root word leuco- indicate in the term leukocytosis? Answer: white rationale. Leuco- refers to white or white blood cells, from the Greek leukos. In leukocytosis, it indicates increased white blood cells. This root appears in leukemia, white blood cell cancer, critical for hematology nursing. 36. What is the root word erythro- referring to in a diagnosis of erythrocytosis? Answer: red rationale. Erythro- means red or red blood cells, from the Greek erythros. In erythrocytosis, it indicates increased red blood cells. Nurses use this root in erythrocyte, red blood cell, guiding blood disorder care. 37. What does the root word thrombo- mean in the term thromboembolism? Answer: clot rationale. Thrombo- refers to a blood clot, from the Greek thrombos. In thromboembolism, it indicates a clot blocking a vessel. This root is seen in thrombosis, clot formation, aiding vascular nursing. 38. What is the meaning of the root word glyco- in a patient with glycosuria? Answer: sugar rationale. Glyco- pertains to sugar, from the Greek glykys. In glycosuria, it indicates sugar in urine. Nurses encounter this root in glycogen, sugar storage, and hyperglycemia, high blood sugar, guiding diabetic care. 39. What does the root word immuno- indicate in the term immunology? Answer: immune rationale. Immuno- means immune system, from the Latin immunis. In immunology, it denotes immune system study. This root appears in immunotherapy, immune treatment, critical for infection and cancer nursing. 40. What is the root word laparo- referring to in a procedure called laparoscopy? Answer: abdomen rationale. Laparo- pertains to the abdomen, from the Greek lapara. In laparoscopy, it indicates abdominal examination. Nurses use this root in laparotomy, abdominal incision, aiding surgical nursing.